Wonderful. Of course, I would like to thank Sue Perks, Wibble Bakker, and Jason Forrest for bringing us together. It has been an absolute marvelous 2 days already, and I hope not to disappoint you with this talk. In the next 20 minutes or so, I would like to focus on pictograms in healthcare. And I don't have a personal preference for either the word symbol or icon or pictogram. And I think it is difficult to define these in all circumstances. But I'll use the word pictogram in this talk because that's the word that is used in the medical profession. And in this talk, I'll focus on healthcare only. So let me start with a few examples. This is a box that contains a COVID antigen test. I expect that most of us will have used some sort of box or similar boxes in the last few years. And I found it interesting to look at the pictograms on these boxes. I've now got quite a collection of these, and these pictograms appear on most of them. I wonder actually if anybody looks at these and tries to figure out what they mean. I look at the second example. This is the packaging of a simple plaster. Somebody has a small bleeding part of their skin or needs to protect their skin against something, and they would like to stick a plaster. There are some illustrations here in the squares here, and there are several symbols or pictograms on the bottom here and on the right here. I'm not sure if I would bother to interpret these illustrations or pictograms before I apply the plaster. A third example, and now it gets fairly serious. This box is for a medicine that's called Epilim. This is a medicine against epilepsy, and it can also be used as a mood stabilizer against depressions. And for these indications, it is really a good and effective medicine. I'll focus on the pictogram. It shows a profile of a pregnant lady. It's recognizable because of her extended belly, her breasts, and a ponytail. The red circle and the diagonal red line are similar to the traffic signs, which means you're not allowed to or do not. And the text under this pictogram states, warning for women and girls. The reason that this information is included is that this medicine will cause malformations in babies and thus cause brain damage in babies. So pregnant women must not use this medicine. And the symbol is very clear, isn't it? I'll come back later to that. The same medicine is sold in Australia. The circle with the red slash has been replaced by a red triangle. That might be an irrelevant detail. This red circle is clearly do not, but a triangle indicates a warning. The main message is still very clear: do not take this medicine if you're pregnant. It can cause harm to unborn babies. But does this difference between the red circle and the slash and the triangle actually have a meaning? I can show you many more examples of the collection of pictograms that I have in medical packaging and medical leaflets and that are used in healthcare. But I will conclude this section by mentioning that patients must get information. Patients need to be informed. Talking and text in words only doesn't work. We need to use visuals in whatever form as an addition and to provide an alternative way to inform patients. It really is a no-brainer. We have to do that, and we have to provide information to patients in all formats that we can actually do. Pictograms don't rely on a language, so they don't rely on the medical language. So ideally, they should be good for patients, and pictograms are expected to be easy to understand. I've copied a few of these pictograms in the bottom line here. And the question now becomes, do these pictograms really help? Which brings me to the second part of my talk. When we talk about pictograms or symbols or icons, what are we actually talking about? And I do most of my work in the medical area. And in the medical world, it is a very close bubble. They mainly rely, or they solely rely on research that's published in medical journals. It's called evidence-based medicine, and it's the holy grail of the medical profession. These medical journals are included in the PubMed database, which is an enormous database that has nearly all medical journals and pharmaceutical journals and anything to do with healthcare and public health in there. If you search for the word pictogram today, you get 505 articles. The first article was published in 1972, exactly the same year that Henry Dreyfuss published his Symbol Sourcebook. Unfortunately, this was an article in Russian, so I don't think there was any relation between Henry Dreyfuss and this particular article. And the number of articles about pictogram gradually increases, and at the moment it is about 65 articles per year. And in this slide, I show you some of the pictograms that are discussed in these articles. You can see that the author really means pictogram because I've kept the caption and the illustration together. This is how pictograms appear in medical journals. And what I would like to focus your attention on is that these images are all very, very different. Some stylize the objects, some are more abstract, some are fairly natural drawings, some indicate sequences, some combine images, and all use graphic marks such as crosses, arrows, symbols, and shapes. So the word pictogram can refer to nearly all visual materials in peer-reviewed academic journals. For me, it is clear that these different visuals cannot be compared directly. The quality of them is too different to make a valid comparison. It's not only the medical journals that have an interest in pictograms on medical information. Information about medicines is strictly regulated, and that's a good thing. And the legal profession has their say too. Here's an image of the legislation in the United States of America. The Food and Drug Administration, the FDA, issued this rule in 2016. And I know it's always difficult to read the legal text in a presentation, but I'm going to try to read the summary. It states the Food and Drug Administration, FDA, is issuing this final rule, revising its medical device and certain biological product labeling regulations to explicitly allow for optional inclusion of graphical representation of information or symbols in labeling without adjacent explanatory text if certain requirements are met. And then it goes on, the final rule also specifies that the use of symbols accompanied by adjacent explanatory text continues to be permitted. This gobbledygook basically means that on information for patients in America, you can use pictograph or symbols with accompanying text, and you can use symbols without accompanying text, and both are allowed. That's the law in America. The law in Europe is very similar. This is the European law that was written in 2001, and it states the outer packaging and the package leaflet may include symbols or pictograms designed to clarify certain information. The lousy thing is that these laws don't define pictograms or symbols, and they don't tell us what the difference is between them. And as long as they are designed to clarify certain information or to explain information, it's fine. The Dutch regulatory authorities were very disappointed with the lack of response from the pharmaceutical industry in the last decades. Basically, not a single industry took up the effort to design a pictogram or symbol to clarify certain information. So the Dutch authorities started developing pictograms themselves. These are 8 pictograms developed by the Dutch regulatory authorities. These were introduced last March, about 7 months ago. And the authorities claim that these pictograms add to the safe and correct use of medicines because they are easy to recognize and accessible to all. Alas, no evidence is provided to support these claims. So it's the medical world shows an increasing interest in pictograms, and we can see that in the increase in publications in medical journals. The legislation supports the use of pictograms. That's people who write the legislation and who would apply the legislation. And the regulatory authorities even provide practical examples how we could use the interpretive legislation to put pictograms on medicine boxes and medicine leaflets. The third group that is involved in healthcare pictograms are designers. On the left is a collection designed by a Dutch association in 2015. This collection of about 150 pictograms was heavily promoted a few years ago. On the right is a collection of medical icons that can be obtained from software developer Adobe. This is only a small selection of the available medical icons that they provide. And there are many more of these collections. For example, the Noun project that was mentioned earlier as well has more than 1,300 icons to show a pregnant woman. The Noun project has 1,600 icons for an infusion bag. And there are many more of these collections of pictograms that focus on healthcare. So to conclude this part, it is clear that we all seem to suffer from pictophilia. The healthcare professionals, regulatory authorities, and designers love making pictograms. Making more pictograms is always seen as an improvement. the expectations about the benefits of pictograms are always very, very high. The terminology is still vague and confusing, but it does not need to be resolved because everybody knows what a pictogram is, or an icon or a picture. The design quality of these pictograms varies substantially, and the empirical evidence for their success is usually very, very poor. And that leads to a question: are pictures always beneficial and never harmful? And that leads to my third part of my talk. I would like to focus on the 5 considerations that question if a pictogram could be harmful in any way. I'm not looking at the positive effects of pictures, I'm looking at the negative effects. Question 1. Who are the people who need to understand these pictograms? The assumption is that everybody can understand these pictograms very easily. On the right are some examples that appear on every package of a COVID test. These pictograms are all approved by the International Standards Organization ISO, the Food and Drug Administration FDA, and the European Medicines Agency EMA. Any patient should be interpreted these pictures immediately and correctly. Clear? So this is what they actually mean. Research has shown that there's a severe risk of misinterpretation and not understanding of these pictograms. They make people feel stupid. That's not an inability or a failure of patients. These pictograms are simply not suitable because people cannot understand them. The idea of the FDA that the pictogram does not require adjacent explanatory text makes sure that most patients don't even have a chance to understand these pictograms. It's an insult to patients what the FDA proposes. The belief that pictograms can be understood by everybody is very harmful. It excludes substantial groups of people who can't understand and who misinterpret symbols. And if you're fair to yourself, how many of these 4 pictograms could you understand immediately when you saw them for the first time? You're part of the group that is excluded by the FDA. The second question is about the actions that need to be enabled or prevented. Again, I use the COVID test packaging as an example. There is no hierarchy in this line of pictograms, so it is likely that persons will have to look at them all. Out of the 11 pictograms, only 2 are remotely interesting when you buy this package. Only 1, read the instructions before use, is useful when you want to test yourself. 3 pictograms are about storage, and the other 4 are not really helpful at any case for any patient at all. These pictograms suggest that people must interpret everything. Instead of guiding patients with relevant information at appropriate times, we give them a puzzle of mostly irrelevant decoration. That is demotivating instead of supportive. And this is harmful because it supports the belief that these pictograms are always relevant. They are not. The third question is about the context in which pictograms are read. I mean, I'm really pleased with earlier presentations that in discussions that context comes out so heavily. I go back to the example that I gave earlier, the valproate medicine and the pregnancy warning. Sodium valproate, this medicine, is an effective medicine for epilepsy and depressions, but it causes birth defects and brain damage in babies. It turns out that the manufacturer of this medicine and the French authorities knew about that years ago, decades ago. The court cases are still going on. In April this year, Sanofi was ordered to pay a fine of 400,000 euros, that's $400,000, to one family. That's a central picture. There are more than 2,000 children with deformations and more than 30,000 children with brain damage in France only, caused directly by this medicine. And you can calculate, of course, the financial risk yourself. But the reason that there is a pictogram on this packaging is that a group of French patients representing these babies demanded this. They have organized themselves in an organization called APSAC, and they believe that the pictogram would help to prevent the use of valproate by pregnant women. And Sanofi thought in 2017 that they could get away with it by just putting a pictogram on the packaging. It doesn't work. In the UK in 2021, between 2020 and 2021, in COVID years, still 50 women received valproate from their doctors while they were pregnant. And that is logical, of course, because doctors never see the packaging. The pictogram should have been on the doctor's computer screen, not on the packaging. It should have been on the pharmacist's computer screen, not on the packaging. Maybe on the packaging as well, but it should be integrated into the whole sequence of events. This example shows that pictogram must be considered in specific contexts. If it's not embedded, pictograms fail to perform and give a false sense of security, and that is very, very harmful. The fourth question is about the quality of visual design. There are many different pictograms that try to convey the same information. All these pictograms are used on packaging to prevent pregnant women taking these particular medicines. There are many different pictograms that try to convey the same information. They all say do not or be careful, and this slide shows some of these approaches. There are even more than these. And all the designers who drew these pictures or these pictograms believed that their pictogram was necessary and was the most effective. Otherwise, why would they bother to design a new one? It is not clear which of these pictograms can be used in which situations, or what the motivations are for the different design decisions. The belief that all designs are equally effective is wrong. Some designs are more effective than others, and not all of these are equally acceptable. Now we have to find out which one is the most acceptable, which ones are more acceptable than others. And the fifth and final question is, what kind of evidence can you supply that people can really act appropriately? This pictures show again the 8 pictograms that were developed earlier this year by the Dutch regulatory authorities. They claim that these pictograms are clear and can be understood by all, and they claim that they have been tested. Of course, the test report is not available, and the results have not been published. So the belief is that it is not necessary to provide evidence, and this is harmful. This just supports the incorrect belief that pictograms are really beneficial for patients. And that's incorrect. Which brings me to the conclusion of the third part. So concluding this third part, my argument is that pictograms do harm health for 5 reasons. There's a serious risk that pictograms are not understood and misinterpreted. Pictograms are not understandable by everybody. There's a serious risk of trying to show too many different types of information in a pictogram. The belief that pictograms can reduce risks and prevent accidents is harmful. Pictograms cannot stand on their own. They need adjacent text and they need clear context. The FDA is absolutely wrong here. In a healthcare context, not in other contexts. The visual design and shapes vary. Not all designs are equally effective. And pictograms usually score lower than expected. Not testing will fuel the idea that the pictograms can really be understood by all. Because you've designed it. It looks good. What's the problem? So these 5 assumptions do harm and could harm individual patients. Okay, I've only got 3 conclusions. The first one is about pictograms in healthcare. It is very clear that patients need information about their medicines and about their treatments. It is also very clear that verbal information or in spoken or written form is not sufficient. It is essential to provide information in all sorts of visual ways as well. Pictograms or symbols or icons or whatever you want to call them are used and will increasingly be used because visuals are essential to inform patients. We need to design more visual stuff for patients in all sorts of situations. Second conclusion is about pictophilia. The medical, the legal, and the design professions love pictograms. And some of these symptoms of these diseases are that adding more pictograms is always a good thing. Expectations of their benefits are always very, very high. It is not necessary to clarify the terminology because everybody knows what you're talking about. It is not necessary to motivate design decisions because you can see what it is like. And the 5th symptom is that it is fine that the empirical evidence remains very poor. And these 5 symptoms lead to the assumption that pictograms are always effective in all situations for all patients. We need to think again. And the third and final conclusion is that pictograms can be beneficial only if they are based on respect for patients and not on a paternalistic idea that they will understand. If pictograms are part of a support for patients, so it can only be beneficial if they are part of a support for patients to adhere to treatments. Pictograms on their own do not change behavior. Pictograms are only beneficial if they're embedded in an information process. The context and the situation must be taken into account. And pictograms are beneficial if designers provide the arguments why visual decisions have been taken. We need to find out why these things look like they do, because then we can figure out if what's effective and what's not. And pictograms are beneficial only if relevant empirical evidence is provided. We need to find suitable tests and suitable criteria, and those are lacking at the moment as well. But the main conclusion is that pictograms can play a relevant part in communication about healthcare, absolutely. That is, if we take the above 5 points into account. But the best thing of this whole talk is that the pictograms on their own do not cause any physical harm. Thank you very much.
Thank you, Karel. Beautifully done.
A standard story, I think. But to come back to Nigel's point, as a last point, the French authorities and the pictogram do not use when you're pregnant caused enormous anger when the pictogram was not there. And when patients were not involved sufficiently about the risks that they took on doctor's advice. And adding a pictogram reduced the anger. So in answer to your question, it's the other way around in this example. Pictograms do provoke reactions, but the lack of pictogram provoked the main action. And then when the pictogram was actually introduced, the anger went down. And your question is, can we do it the other way around? Can we develop a picture that actually makes people angry and provoke people into action?